This video will demonstrate the MAR and the MAR summary. You can access the MAR summary by clicking on MAR summary in the patient's chart menu. MAR stands for Medication Administration Record. This displays a view-only record and it crosses encounters, so we can see medications that the patient has had ordered for them and what status the orders are in and the doses are in. You cannot administer from this screen. Doses to be administered in the future appear in this column here. The yellow column is the current time. Anything historical is to the right of the current time, and any future doses are to the left of the current time. If we right-click on a medication name and click on Event/Task Summary, we will see dose information in a graphical format. If we right-click and select Order Information, this is where we'll be able to see the medication details, any comments, date and time of the orders, and dispense information. And if we right-click on a medication name and select Reference Manual, a decision support screen will open, which provides information about the drug. Click OK to close this window. As discussed, a grey cell with the time is a future dose due. You can see here we have a field that says not done, withhold as per medical officer at 12 o'clock. This dose of insulin was withheld by the medical officer. If a medical officer has withheld a dose, it will say not done. If you see the terminology not given, that has been documented by a nurse. So in this instance, the metoprolol was not given because it was clinically inappropriate, and you can enter a comment. We can see that there is a comment icon here. We can see a red field with a little alarm clock, and that indicates that the medication is overdue to be given. Moving down to our PRN medications, they appear in green. We can see that 5 milligrams of this medication was administered at 6 a.m. and we can see that it is a PRN. Finally, we can see a bag of fluid running for this patient down the bottom here. We can see that the bag was begun at 6 a.m. Our filter is currently set to all medications. It's best practice to leave your filter on all medications, because if you select all active medications, you won't see any discontinued medications or once-only doses that have been administered. We can modify this screen. On our date range bar here, we can right-click and change the properties. At the moment, you can see that we're seeing a 48-hour time frame. Right-click, change defaults, and for example, you can set your filters to be 24 hours back and 24 hours into the future. And I'm going to change my columns to 24-hour columns. I can change the font size too if I'd like a larger font. In summary, the MAR summary is a view-only screen which will allow us to look at previous medications ordered across encounters and also see current medications and future medications. Next, I'm going to navigate to the MAR, the Medication Administration Record. This is where nursing staff will document the administration of a medication. Down the left-hand side of the screen, we can see that we have time view, which means we're looking at all of our medications that are scheduled for our patients. So we have the category of scheduled, PRN, and continuous infusions. You can filter down what you see here by clicking on Therapeutic Class View to see medications categorized by their therapeutic class. And Route View for route of administration, Plan View if they're part of a power plan, and Taper View if they're being tapered. Each of these boxes is a dose. A blue dose indicates that it is a regular or scheduled dose that can be administered. Anything that is grayed out means that it's a future dose and it cannot be administered as yet. We can see we have a blue dose that can be administered for the paracetamol. However, the next dose of paracetamol due is grayed out and we're unable to document that we've administered that. If we see a cell that has got white writing and is red, that means that it's an overdue medication. If we were to see a red cell with black writing, that would indicate that it is a stat dose or a now dose to be administered now. When we looked at the MAR summary, we saw the nursing comment of not given. You can see that information shows in these result cells down the bottom here. If you have any discontinued medications, they will populate down the bottom here. And we can see, because this was a once-only dose of insulin and it was charted as not done, it has now fallen into a discontinued state. So if your filter is on all active medications, you will miss seeing that information. This screen relates to the current encounter only and is locked down to a 48-hour period for patient safety reasons. And again, very similar to the MAR summary, the yellow column is the current time, anything to the right is the past, and anything to the left is the future.